Greetings and welcome to another episode of Going All In, Get the Edge You Need to Succeed. I'm Dr. Erin McKinley, and today we have another awesome spotlight session with Dr. Cassie Vanderwall and Makayla Schuchardt from the University of Wisconsin Integrated Graduate Program in Nutrition and Dietetics, based in Madison, Wisconsin. All right, welcome to the podcast. To get us started, I would love for each of you to give us an introduction to you, your journey to RD, and how you landed with University of Wisconsin.
Right. Well, I can start. My name's Makayla Schuchardt, and I'm a registered dietitian that works in Madison, Wisconsin. So I have a role at the University of Wisconsin as the kind of coordinator of the online master's in clinical nutrition degree, and work very closely with Dr. Vanderwall and the integrated program at UW Health to provide the integrated graduate program in nutrition and dietetics. Personally, I've kind of come full circle. I'm from Wisconsin, and I went to the University of Wisconsin-Madison for my DPD. I then did a combined program in New York at the Bronx VA and NYU, earning a master's in clinical nutrition. So my path has mainly been clinical. I worked at the Boston VA hospital for a few years and then returned to Madison and worked full-time as an inpatient adult dietitian at UW Health. So when I began my role at the university, where I do some teaching and advising, I was able to continue to practice at UW Health. So I really enjoy the combination of advising, instruction, but yet still being able to practice with the excellent dietitians through UW Health.
Hi, everyone. My name is Cassie Vanderwall. I am the program director for our integrated graduate program in nutrition and dietetics. I'm also the manager of our ambulatory clinical nutrition team at UW Health and oversee some of our nutrition programming. I fell in love with nutrition at a very young age as I found out the power of food in terms of preventing and managing chronic disease, watching many of my family members struggle with nutrition-related diseases that I learned could be managed with food. So I went on to complete my DPD at the University of Illinois in Urbana-Champaign, and a combined program with a master's in clinical nutrition at Rush University Medical Center in Chicago. After that, I onboarded at Rush and worked there in a clinical role for a few years. And then when our family relocated, I moved to lovely Madison and transitioned into the ambulatory world. So my clinical appointment currently is in pediatric multidisciplinary care. I also have some academic appointments in the School of Medicine and Public Health, and then of course enjoy precepting and overseeing our program here at UW Health. I am excited to introduce you to not only our program, but UW Health. UW Health is an affiliation of different healthcare organizations in central Wisconsin. We have partnerships all the way to Minnesota, to Iowa, and throughout, of course, the southern region of Wisconsin and northern Illinois. Our program, the UW Health Integrated Graduate Program in Nutrition Dietetics, really represents all of those affiliations and partnerships as we have close ties with medical education and academic scholarship. So we are an academic medical center and tertiary care hospital at UW Health. We maintain several centers of excellence and areas of specialty with clinical nutrition embedded into each of those. Some of those include our Carbone Cancer Center, our highly ranked transplant center, and a number of ambulatory primary care and specialty care clinics. We also, through the aforementioned affiliations and partnerships, can provide a vast array of public health education opportunities and now food system opportunities as well. Our program is a future education model demonstration program, and thus an integrated supervised experiential learning opportunity that really brings to life the graduate coursework that is completed simultaneously with these experiences. We embrace the technology of UW-Madison and UW Health and value these academic and research environments. We are consistently striving to achieve diversity, not only within our program, but in our profession, and doing so through equitable access and inclusion in our programs. So it is our mission to provide a progressive and effective course of study that integrates supervised experiential learning, or those formerly known rotations, with our graduate coursework to prepare our graduates to practice and develop high-performing dietitians that are really lifelong learners and carry that professional skill set to not only meet the demands of today, but of future dietitians. And we complete this mission through several goals. The first is that our graduates will secure and demonstrate evidence-based knowledge, a high level of problem-solving skills, and those critical and divergent thinking skills that we use every day in nutrition and dietetics. And probably most importantly, that our graduates are equipped and empowered to pursue their career goals successfully upon graduation. And we believe we're achieving those goals, and that 97% of our graduates pass the RD exam on their first attempt. And all of our interns historically have eventually passed that exam. And we have very strong placement post-graduation within 6 months in a variety of domains. As you can see here, the majority of our graduates land in the clinical environment. And this is primarily because we only maintained one concentration or track in the clinical realm. But now that we've added public health and food systems as concentrations for our program, we likely will see different domains of this pie grow, including those in public health and food systems. So I'd like to share too, not only where we are at, but where we are going. As I shared, we are really committed to diversifying dietetics. Therefore, we look closely at our admission policies and procedures to make sure that our program has equitable access and is inclusive. We also look at how we market our program to make sure that we have far-reaching across the United States to be sure that we can represent geographical diversity as well. And then also taking a close look at our curriculum to make sure that it's accessible to people of all abilities. And we do this through our partnership with UW-Madison. As I shared, we are a future education model program currently in the demonstration phase, but look forward to going through that accreditation process. COVID-19 assisted us in leveraging technology with a very swift onboarding, but we definitely feel comfortable now in the flipped classroom environment, as well as providing our students with not only face-to-face opportunities, but virtual opportunities. And in the recent past, we added a community partnership opportunity for all of our students that really upholds the values of service and social responsibility at UW Health. And we look forward to increasing the number of partnerships that we maintain to advance our comfort level at interacting in the public health and food system domains. And this will strengthen all three tracks that are available for our students to apply to: MNT, public health, and then food systems administration. So now I'll share the facets of our supervised practice program and then hand it over to Makayla to talk about our graduate coursework. So currently, our supervised practice program admits up to 20 students per year. These students are selected in the winter through a pre-select track. And then again in the late winter, so January, February, in a pre-DICUS. As you may know, future education model programs are not permitted to participate in DICUS at this time. So what we do is we not only have our pre-select to support our partnership with UW-Madison, but then we have a pre-DICUS selection, which would be our primary selection process. Then we offer something similar to the secondary match opportunity through DICUS, where we have a post-DICUS selection period as well. So we really host 3 opportunities for individuals to apply. And then students are onboarded in June, but hosted in their supervised practice experiences August to May. And staff, meaning program staff, as well as preceptors and faculty, work collectively to select these candidates. We offer a 39-week full-time program for all of our concentrations. And this full-time program is in direct reference to our supervised experiential learning opportunities that add up to be well over 1,200 hours of supervised practice and are scheduled usually at 32 hours per week. But we do have opportunities for part-time student commitments if students need to work outside of their internship commitments. These supervised practice hours are allocated into 2 graduate courses, which are called Nutrition and Dietetics Practicum 1 and 2. The first that you see on the slide before you is a concentration of our ambulatory, food systems, and public health experiences. And the range of weeks is dependent upon the concentration or track that the student is placed into. Practicum 2 represents our clinical allocations. There have been some changes to these weekly allocations simply because we believe we are a living, breathing, evolving program, and we learn from our students of the past and our preceptors of current times. And we have found, for example, this year that students would really benefit from more time in our baseline clinical skills experiences. So we've expanded this opportunity to 2 weeks now, where students get a little bit more grounding in what medical nutrition therapy is, how to document, how to engage with patients upon bedside, and therefore we can flex the following clinical nutrition experiences to meet the needs of the student. The majority of our experiences are scheduled and maintained at our main hospital campus, which is University Hospital and the American Family Children's Hospital in Madison, Wisconsin. But as I shared, we have a number of affiliations across the region. So if we have a student that, for example, sees themselves in public health or sees themselves contributing to rural medicine, then this likely is not the best environment for them. So we really do try to leverage, again, those affiliations and partnerships to craft programs that meet the needs of our students, and therefore may place students at a smaller hospital with lower acuity patients and a much slower pace, because that's going to meet their needs in the end. And now commenting on our precepting team, our teaching team is truly what makes our program what it is. Our teachers are high-level credentialed clinicians, many with advanced degrees and specialty certifications. And because at UW Health, we practice a very specialized care model, meaning there's one dietitian for every unit or one dietitian for every specialty clinic. We have a very large team, but we have a very specialized team. We also then are able to provide experiences that are one-on-one, and then pair those teaching opportunities with students with very direct interests. So a few fast facts about our team. They make our dietetic internship or future education model program what it is. 83% of our preceptors are currently dietitians. As I shared, many have advanced degrees with several PhDs on staff, and just shy of 50% have specialty certifications, such as those certifications in nutrition support or certified diabetes educators. We have a certified lipid specialist, and many that are on their way to becoming certified eating disorder specialists, renal specialists, you name it. Those CDR specialty certifications are represented on our team. And about a third are also alumni of our program, which I think makes it an even more rich experience because they are well versed in what it is like to be a student in our program and are able to pour back into the program as a result. We also train our preceptors and reorient our preceptors on an annual basis using CDR's roles of their preceptors. So we dig into each of these roles and provide our teaching team with resources to foster their growth and comfort level and confidence in really functioning at the highest tier possible, whether they're communicating, educating, or serving as a mentor.
Okay, so I think I'll transition a bit more to talk about the graduate degree program. And I apologize, we still have UW Health Dietetic Internship in a few slides, which may confuse you. But the fact is that our dietetic internship has been around since 1953. So this is a very established program, but what is a bit newer is a partnership with the University of Wisconsin-Madison, particularly the Department of Nutritional Sciences. So we all fall under the University of Wisconsin, but we are now officially partnered through the FEM model. So this slide just shows what the general full-time schedule looks like. So our program is a little unique in that it is an online graduate degree, but all of the clinical supervised experiential learning rotations are done on site, as Dr. Vanderwall explained, in Madison and our affiliated sites. So you begin the program in June. That is what we call Summer 1. You take 3 graduate courses, and these are 100% online. So the benefit is that if you are a new DPD graduate, you are able to live anywhere. Just knowing that usually by August 1st, you need to be here in Madison, living where you plan to live during the program. In the first fall semester, you continue to take online graduate coursework, and then you begin your 4 days a week of your practicum. The same thing happens in spring. You're continuing your coursework and your practicum. Then the second summer, we call that Summer 2, you can finish up your graduate coursework so that you are able to earn the degree at the end of the summer. And that gives you an opportunity to really explore where you see yourself going. So we know that many of you come into internship very open to different areas of practice. And hopefully by the 4th semester, you have narrowed down an area that you would want to explore. So you're able to do that through some free elective choices in the curriculum and doing an externship. So this might be an opportunity that you could continue to focus on specific clinical areas through our UW health system, or perhaps you have connections closer to your hometown or where you're looking to gain employment, and you are able to set up an externship there. In addition, we have some students that are interested in doing research through the School of Medicine and Public Health, and might even want to use it to do a community outreach project. So it's very open, and we work with you to essentially narrow down what will help you get to where you want to be. So all the courses shown on that slide are required. There are options for some free choice and electives. If you're in our public health and food systems track, you can take up to 6 free choice credits. If you're in our medical nutrition therapy track, you have 3 elective or free choice credits. What we're looking for you to achieve is you need to meet all the competencies that are put forth by the Future Education Model program. And we do this through the graduate coursework. And overall, we do need a student to maintain a GPA of greater than 3.0, which is not only a graduate school policy, but that is our ability to help monitor and make sure that you are growing to that competent level, and so that you're ready for unsupervised practice when you're done with the program. Because of the 2024 requirement, majority of our students will most likely come in not having a graduate degree. And so you will complete a Master of Science in Clinical Nutrition. If you already hold a graduate degree, this would be a great opportunity to reach out to us and learn more. But there is a capstone certificate in clinical nutrition, which is not the full graduate degree. We do an assessment of your prior graduate coursework, and we can determine what courses and competencies you still would need to meet based on your prior coursework. So what are we looking for? So here are a breakdown of our costs. And so the top portion, these are our set fees. So you can see above the blank line, we'll just start, there's an application fee. The university charges a one-time document fee. A one-time $1,000 research fee is paid directly to UW Health, and this supports kind of the research project within the program. So it supports help with statistical analysis, poster presentations, going to conferences and presenting that research. The program fee I have for tuition, it is a 34 credit program, and we charge $800 per credit. That is for in-state and out-of-state. And so that total is $27,200. The rest of the costs do tend to vary depending on where you live and how much you need to budget for those things. So even though we are a future education model, we still require a didactic program in dietetics verification statement. So as you can see, our program is quite accelerated, and the graduate coursework is built that there's an expectation that all students coming into the program already have a strong foundation in human and clinical nutrition and have that background in food science and food systems. So you do need that DPD verification statement. The minimum cumulative GPA that the graduate school at UW-Madison requires is a 3.0 on a 4.0 scale. We do want to note that if your GPA is less than 3.0, please reach out to our team. We do have the ability to look at an applicant from a holistic view and not just at the GPA. We value a lot of experiences. So there is still an opportunity that, we really value students, even if the GPA may not be there. Often we get questions about visa status through our program. So because the graduate degree is technically 100% online, meaning greater than half of the coursework is offered in the online route, students are unable to maintain student visa sponsorship throughout the program. So you would need to maintain work authorization if you were to join the program, and that most often is through using OPT. Here is our updated application procedure. So as you know, and as Dr. Vanderwall said, because we're an FEM program, we do not participate in the DICAS match. However, we have found that the DICAS application itself, all those experiences that you enter are really valuable to our selection committee. So first step is that hopefully you have already started a DICAS application. So you can just go into the portal and work on entering all of your specific information. Once you have your things such as your personal statement, all your courses entered, and all your activities, you can just save that as a PDF file. One thing we do ask in your personal statement is please indicate what track you're most interested in, if it's MNT, food systems, or public health. So once you have that PDF of the DICAS information, you'll then head to the University of Wisconsin-Madison's graduate school electronic application. And so this is how you will actually apply to the program and to the university. So once you're in there, you will request 3 letters of recommendation. You'll submit unofficial transcripts, and then you will attach in the supplemental materials that PDF from DICAS. So we kind of created a hybrid application, which is very useful. The third step, though, is we are looking for the following items to go directly to Dr. Vanderwall at UW Health. Your declaration of intent or verification statement, a separate application fee for UW Health, and you can send that to the address there. We do recognize this is a very confusing process. So we have done webinars in the past just on this. We have an enrollment coach that works with us. So please reach out with any questions. And I would like to point you to Katie Bootson, who is our graduate program coordinator. And she helps us with organizing all this information and is also a great contact to help you with the application process. Here are some more specifics after, just so you are aware if you are admitted to the program. And I think I'll hand this back over to Dr. Vanderwall.
So once a student is enrolled in our graduate program, they are also considered an employee of UW Health. And this allows them to function right on any of alongside any of our members of the healthcare team as a registered dietitian or dietetic intern. So these are the requirements for all of our employees to aid in their onboarding. We also have a few other requirements that are not only required by UW Health, but again, by many of those affiliated partners. So if we can get them all done in one place, this helps to expedite onboarding at affiliated organizations during the program, so that as individuals change their supervised experiential learning opportunity every 2 to 4 weeks, they don't have to recomplete these types of requirements. We can rather attest to them. And then when it comes to candidate considerations, we have really taken a close look again at the accessibility of our program. And these are by no means ranked or listed in order of preference by our selection committee, but they are all valuable criteria and considerations. So the personal essay or statement we consider, does the applicant express a passion and dedication to the profession? Are they able to articulate their professional goals or trajectory? What is their grade point average? What is their overall DPD specific and science GPA? And then as a reference to their academic and professional mentors who give, of course, hopefully glowing remarks of themselves. And then, as Makayla noted, it's not all about academics. We also look to our potential students' experiences as it relates to their overall development of their professionalism, their volunteerism and service, their dedication or interest in research, and their teaching and leadership experiences as well, as we consider these sometimes equally or more valuable than the marks that they received in their coursework. And of course, we invite anyone to meet us in Madison. Right now, it's easier to meet virtually thanks to the COVID-19 pandemic, but we hope to get back to meeting face-to-face with students and introducing them to what Madison is in terms of being a food and nutrition capital of the United States.
All right, thank you for an overview of your program. I'm going to jump right into the 5 questions that I ask all of the programs that come on the podcast. And these were put together with the help of my students to make sure that I was asking the questions that they really wanted to know the answers to. And so the first question is, what is one thing in particular that you just really love to see when you're reading an applicant's personal statement?
Yeah, so my number one, the personal statements that stand out to me are the students who have clearly taken the time to research our program. So you can tell that they've learned a lot about our program, UW Health, the University of Wisconsin, and they understand and know the expectations of the program and what they'll be, I guess for better words, getting themselves into. And so I'm always looking for that fit. So I tell my undergraduate students, it's okay if you don't know exactly what area of dietetics you want to practice in, but make sure your letter is conveying why our program will help you discover that. So if you have a strong interest in clinical nutrition, you're drawn to our program because it's an academic medical center and you can have a wide variety of clinical rotations that will prepare you to work at another medical center. But if you've worked in clinical and you find yourself drawn to the community setting and policy making, explain why and why our public health track would then be a better fit for you. So that's what I feel like they always stand out, is when they've done their research and they are able to articulate why we would be a good fit for them and they would be a good fit for us.
And I would say for me, it would be what I would like to call evidence-based passion. So I think it's easy to express our love and value for nutrition, but I like to hear those words from students as to why they fell in love with food and nutrition, but also what they've done in their young academic careers or professional experiences that support that passion. Again, whether it be a leadership experience, employment opportunity, service, as well as the trajectory, what they hope to do upon completing the program.
All right, well, my second question is a true or false question. So true or false, an applicant's resume should be 1 page and 1 page only. Either way, why?
So I had to really think about this. I just had a student in, and I guess I would say mainly true. And that's because the way our application systems are set up, I like to see the resume as like one page, quick glance of, where did you do your DPD? What kinds of experiences have you had? Okay, you've worked at a skilled nursing facility. Oh, you've done research in this lab. And that's really what I'm looking from the resume. Then I go in and I like to see all those details in that die-cast portion where they're explaining the activities, the hours, there's more specifics of what they've done. So I prefer short and sweet. So yeah, I'm curious to hear too what Dr. Vanderwall thinks. That's one opinion, right?
No, I would agree. I would say that one page is, again, that global view, but I also believe when you ask someone to put themselves on one page, you can really find out what's most important from their experience to them. And that is also important to us because I believe that is what they want us to value equally.
All right. Well, my next question is my favorite question to ask program directors. And it's, what is one thing or more than one thing that an applicant may do? And this could be in communicating before the application, in the application itself, any contact that you may have with them, that they do something, say something, indicate something that's a red flag to where you would think maybe this person isn't the best fit for our program.
Well, for me, it's being disrespectful to anyone along the way in any communication, whether it's to a preceptor, a fellow student, or our selection committee. We at UW Health ground everything we do in respect for people and respect for all people. So when that is violated, it really does send up a red flag.
Yeah, and I agree. I was struggling with this question because there are obviously kind of classic things, do your research on the website first before emailing a list of questions. But those necessarily aren't deal breakers. I think that's just growth that a lot of students experience during the application process. But I agree. Anything that really might show a red flag of more of an interpersonal inability to work successfully with a diverse patient and team, whether it's in our department, that would be, the red flag from my end too.
All right. So what is one aspect of the program that you really feel separates you from the competition?
I should come up with a better tagline. We work with our marketing team at the university and they're great. So I think with our transition, we are offering a relatively accelerated 4 semesters, no summers off, pathway to the RDN credential. It is at an academic medical center and an excellent university, the University of Wisconsin-Madison. And we do this at a cost that we hope is still accessible to a large number of students. So when we were designing the program, we really put a lot of thought into the total cost of the program and the options for part-time versus full-time to make sure that our program, even though it is accelerated, it demands a lot of the student, can be an extremely rewarding program at a great value from our institution.
And I would say from my standpoint, it's really our ability to individualize our programs. So I think historically dietetic internships have been very cookie cutter. You knew how many hours you were going to get here, how many hours you're going to get here, but with a competency-based program, it truly is supposed to be student-based and student-led and student-centered. And I believe with the number of partnerships we maintain and the opportunities that lie within the UW Health family, if you will, we're able to craft a program plan around a student's interest and, again, professional trajectory.
All right. Well, my last question of the 5 is a 2-part question. So the first part is, what would be the 3 best adjectives, and these could be descriptors or phrases, that you feel best describes your program overall?
I might have to send this to Cassie. I prepared the 3 best adjectives to describe our students. So maybe I'll answer that instead. So I misread the question, but I describe our students in the program as organized, independent and driven learners, and they possess strong professional skills. So that's our students. And Dr. Vanderwall, you can give the 3 for the program.
Happy to. I believe, as I shared before, that our program is individualized, offers multifaceted learning, which means we really do look at the learning styles of our students and try to craft those experiences around their strengths, but also develop those modalities that may be underdeveloped. And I would say that we are a true representation of academic, medical, and community partnerships.
All right, so that second half was the 3 adjectives to describe your ideal applicant. So Makayla, would you say that that mirrors the current students is what you would like to see in applicants as well?
Yes. So I just answered the second question. So organized, independent, and driven learners, and having strong professional skills. So
Cassie, did you have any adjectives to add about ideal applicants?
No, I would definitely support those. Those are students that stand out.
All right. Well, I just have a couple of extra questions I wanted to ask. And the first one is, how are you currently or planning to implement diversity, equity, and inclusion information into the curriculum and the different experiences for the interns?
I'd be happy to take this one first. We, in our supervised experiential learning opportunities, have looked very closely at what the majority of these experiences can offer in terms of diversity, equity, inclusion education, and then developed almost a sub-curriculum that we deliver in seminars to our students to help them foster a skill set related to cultural competency, but also cultural humility, so that when they provide clinical care, it's culturally responsive, which means that it meets a patient right where they're at, provides a holistic assessment, and then crafts an education plan and monitoring plan, as well as those goals that are patient-centered in light of who that patient is, what resources they have at their fingertips, what their health literacy is. So we feel fairly confident that at the end of our program, we are maintaining cultural competency, but also cultural humility. And then we also invite our students to use those critical thinking skills, problem-solving skills to poke holes in our curriculum and in our organization, our healthcare environment, to see how we can improve all facets of innovation, diversity, equity, inclusion, and access, to make sure that we are not only functioning and evolving from our perspectives, but from our students' perspectives as well. And I can share one fruit of that process. Last year, we had a very motivated student that recognized that weight-centric care in clinical nutrition can be harmful. So she developed a curriculum that would foster weight-inclusive care amongst not only clinical nutrition providers, but all medical providers. And this work has now been embedded into our organizational DEI microlearnings and is open to the entire organization. So that just is an opportunity, an example that lies ahead for our students. And I guess our organization too, to continue to evolve to meet the needs of all patients.
All right, perfect. Well, I just have one last question that I don't think I heard the answer to when you were going through some information about the program. How do you currently integrate RD exam review material into the program?
So currently, we really dedicate more time and effort in our, what would be the 3rd semester of the program now, to RD exam preparation. We utilize monies from the research fee that students pay to purchase a RD exam review package on their behalf. It can be either an in-person conference that they attend or recorded sessions, again, based on their learning style and preference. And then we have group RD exam review sessions that are taught by preceptors of the program. And we have 4 of those, which represent the different domains of the exam. And then we also secure spaces for the students towards the end of the program where they can come together, whether it's a virtual space or an in-person space based on their comfort level and preference, to study together and provide resources such as flashcards or practice exams, things like that.
Yeah. All right, well, that was all the questions that I had for today. To close out our episode, I would love for each of you to give us a quick take-home message to potential applicants.
The take-home message is that the UW Health Integrated Graduate Program in Nutrition and Dietetics at Madison offers what I would say a holistic educational opportunity for those that are interested in whether it be clinical, public health, or food systems. And I would invite anyone interested in learning about our program to contact us directly at dietintern@uwhealth.org.
And I would just add, we have traveled to Fancy for the past few years, really promoting our program because we are trying to create a more diverse class. And that includes geographic location. So my last pitch is that Madison, Wisconsin is a beautiful city. It does have all 4 seasons, but most people that move here from different climates end up falling in love with Madison. So I would say if you've never thought about the Midwest, give Madison a look.
Thank you again, Dr. Vanderwall and Makayla, for joining me on this episode. And for those at home who would like some more information on this integrated program with the University of Wisconsin and UW Health, I've included their website link in the description below this video. And as always, don't forget to like this video and subscribe so you never miss an episode with another awesome dietetic internship. And we'll see you next time.